Yeah. So I welcome everyone for today's live webinar, and let me introduce our guest of the talk, Dr. K. Samyuktha. Dr. K. Samyuktha is a renowned urologist and urogynecologist, and she has done her MS General Surgery and MCH Urology from Usmania Medical College in distinction. And she specializes in endourology, female and functional urology, and urogynecology and laser urology. She has presented many papers in both national and international conferences, and today we have her, and she's currently working at Srikara hospitals in their main branch in RTC Crossroads. And so today we have Dr. K. Samyuktha, the guest. And ma'am, we all welcome you for today's live webinar. And ma'am, it's over to you.
Hello, everyone. As he said, hi, I'm Dr. K. Samyuktha. So I'm happy that this is one way of interacting with everyone. So I thank the Mallapuram team and everybody for this webinar. So let's get straight to it. We'll keep the PPT short and sweet so that we can have more of an interactive session.
Yes, so, ma'am, for the attendees who are there in the webinar, if you have any question, any query to be asked, we request you to please raise your hand in the panel which you have, raise your hand. Then we'll allow you one by one to talk, to have a direct question to the doctor. Is that okay?
It would be great if you can allow me to...
Oh, yeah, sorry, ma'am. 1 second. Yes, ma'am.
Yeah. So I would like to talk about the most common thing that is generally seen in terms of urological practice. One is, and especially in the summer season, one is the urinary tract infections and the other is stones. Stones, be it in the kidney or the ureter, that is the pipe connecting the kidney to the bladder or the bladder. So I would like to give you all a gist about what would cause these stones or infections and how you can prevent them, and a couple of home tips or remedies to prevent the infections. Great. So the main objective of this presentation is, first thing, you have to understand that what is a urinary tract, or what are the parts that a urologist deals with, and then how do urinary tract infections occur, what are the risk factors associated with it. How can we simple, in easy terms and in very accessible way, able to diagnose urinary tract infections, and how to manage, be it infections or stones, in different ages and groups. So urinary tract infection, as the name says, it is infection in any part of the urinary system, be it in the kidney or the ureter or the bladder, is called as urinary tract infections. But generally the infections of the lower tract, that is the bladder and the urethra, they are called as cystitis. And these are much more common when compared to the infections of the kidney or the ureter. And in general, when you take the census into account, women are more prone or at greater risk of developing UTIs when compared to males. Why? One, because the urethra in females is very small. It's only about 4 centimeters. And the other thing is the urinary tract, the opening of the vagina and the opening of the anus, all of them in women are very close by when compared to that of males. So the chances of cross infections are very high. Okay. If we have to talk about urinary tract infections in males, urinary tract infections in males generally are not very common, but they are generally seen in males after the age of 50. Why? One, because of the prostate enlargement. And the other thing is either surgery or any other procedures that are done in men. Because of that, the chances of infections are generally high. As I have explained, the the urinary tract consists of a pair of bean-shaped organs called kidneys. The pipes which connect the kidneys to the bladder, which are called as ureters. Then we have a bag-like structure into which the urine drains, which is called the bladder, and the pipe which lets out the urine called as urethra. In males, there is an organ called prostate just below the bladder. Females do not have that organ. Okay. So what are the risk factors that generally cause infection? This is a very elaborate thing. But generally in our country, one of the most common causes is because ours is a hot and tropical climate. One, not having adequate amount of water. The normal amount of water that we are supposed to have per day should be somewhere between 2.5 to 3 liters. But because of drinking less amount of water, we go into a phase of dehydration. So what happens because of that, the urine becomes concentrated. So once the urine becomes concentrated and acidic, the environment is more favorable for infections to occur or stones to form. The other thing is holding urine for a very long time. So this is generally seen in the working class population, where they do not like the washrooms that are present in their surrounding, in their workplaces and all. So they tend to hold urine for a very long time. So holding for a urine for a very long time also can lead to urinary tract infections and stones. Apart from that, the other things can be like if the sugar levels are not under control, or unhygienic, the usage of unhygienic washrooms are the most common causes of urinary tract infections. Apart from that, sometimes obesity, usage of certain drugs which cause stones or infections, or patients who have cancer and have taken drugs like immunosuppressants, steroids. All these conditions tend to reduce your resistance levels and make you prone for urinary tract infections. So generally the bacteria that commonly cause urinary tract infection, you might have seen from your relatives or your personal experience, that when you do a urine for culture sensitivity, you generally say something like an E. coli or a Klebsiella or Proteus. So these are generally the most common bacteria that tend to cause urinary tract infection. And this E. coli is generally seen in your gut flora. Gut is your abdomen, your intestinal bacteria. This through cross contamination can cause infections in the urinary tract.
Ma'am, what exactly is this cross contamination like?
Yeah, we will take all the questions once the PPT is done.
Yeah.
And then I can explain each and every question in detail. Okay.
Right, ma'am.
Yes. So generally, what are the symptoms that the patient complains of? Usually kidney stones and UTI, the symptomatology is quite similar. So they complain of a severe upper back pain. It's a pain that occurs on either side of the spine, be it right or left. That pain can radiate from back to the front. For men, it can radiate into the testicles also. They complain of severe burning sensation in the urine, pain while passing urine, lower abdominal pain or discomfort. Some may complain of low-grade fever with chills. They can have a sensation of nausea or vomitings. All these situations are generally seen. In some situations, when the infection becomes very severe, blood in the urine also can be seen. So these are quite common terminologies that a lot of patients ask me. Now, what is complicated UTI or what is uncomplicated UTI? Even though the terms seem complicated, the actual understanding of it is quite simple. Complicated UTI means UTI that occurs in a person who is suffering with comorbidities. That is, if UTI occurs in a person who is having diabetes or hypertension, or is on various drugs for the treatment of cancer or other autoimmune diseases, or certain nervous problems, bedridden patients, they all come under complicated UTI. It's not that the urinary tract infection is complicated. It means that urinary tract infection in a person who has multiple other entities too. Uncomplicated is a UTI which occurs in a normal, healthy person, which is a first-time episode. Okay? So now what if you neglect urinary tract infections? What can happen? One, if you try to take over-the-counter drugs or don't deal with it or just have painkillers and try to subside it. So one thing is the bacteria still resides inside the body. So the chances of recurrent infections are high. Once the chances of recurrent infections are high, the infection which was contained only up to the urinary tract now ascends upwards into the kidney. Once it starts escalating into the kidney, the chances of kidney are high. And once the kidney infection is high, the chances of permanent kidney damage and renal failure can also occur. Sometimes what happens is the kidney infection becomes so severe that the entire kidney gets filled with pus. So then the patient can enter into another severe condition called as sepsis. That is, the entire body gets filled with infection and that becomes a very serious condition. The other thing that can happen, this is very commonly seen, especially in women, is after repeated attacks of urinary tract infection, the urethra, which we spoke about, that is the opening from the bladder to outside, becomes very narrow because of repeated infections and scarring. So because of that, women generally more than men suffer from inability to completely pass urine, increased frequency of urination, passing urine in very small quantities and all that. Okay. So anytime, at any point of time, be it first episode or multiple episodes, urinary tract infection has to be seen by urologist and treated. How do we diagnose a urinary tract infection? So urinary tract infection is basically, it can be diagnosed by two simple tests. One is a urine test, the other is ultrasound test. The other tests that I put in a PPT like CT and cystoscopy come into the higher advanced stages. But the two basic tests that can basically detect this is CUE. CUE, why? CUE means complete urine examination. This will tell you about the total amount of pus cells present, any RBCs are present, is there bacteria there or not, any other substance like sugars or albumins, how is the urine pH, what is the quantity of pH, what is the color of urine, all of this is told in a complete urine examination. Next comes the urine for culture sensitivity. This is done not just generally in first timers, but patients who are suffering with recurrent UTIs. Why? Because it is very important to identify the bacteria and treat it with a particular antibiotic in a patient suffering with multiple episodes of UTI, because the antibiotic that you use without doing a culture may or may not work for them. So it is very, very important in a person who is having multiple episodes of UTI to undergo urine for culture sensitivity. So generally, sometimes a person who is having repeated attacks of urinary tract infection not subsiding with medications and all, it is important to get an ultrasound done so that we are not missing out on other entities like kidney stones or pus or any other infection. CT, abdomen and pelvis and cystoscopies are done when no diagnosis, you cannot reach any diagnosis through urine test or ultrasound. Then we go for higher advanced tests like CT, abdomen and cystoscopy. Cystoscopy is nothing but it is a simple daycare procedure where we pass a scope, which is our camera, into the urinary bladder to check if we've missed out on anything else. Okay. So how do we treat UTIs? So UTIs are basically two types. Symptomatic UTI, asymptomatic UTI. What is symptomatic UTI? The patient will come with symptoms of UTI, as I've explained before, like burning sensation in the urine, lower abdomen pain, or fever, nausea, vomiting. When they have symptoms like that, yes, we do a urine test, we do an ultrasound, and then based on that, we place them on antibiotic therapy. The other thing is asymptomatic. That is, patient does not have any symptoms, but when he's gone for a general checkup, he's got done a urinary tract CUE test has been done, and in that pus cells has been detected. In such situations, antibiotic need not be given. It is not necessary for it. Only in special situations, like if the patient is pregnant or a bedridden patient who is on Foley's catheter for a very long time, or if the patient is immunosuppressed, that is, if they are using drugs which reduce their resistance, only in certain special situations, even if they don't have symptoms, we still treat the UTI. Otherwise, asymptomatic UTI does not require any antibiotic medication. You can just ask the patient to have ample amount of water. That is, if they can have 2 to 2.5 liters of water per day. Non-diabetics can have coconut water, barley water. We can have what you call buttermilk, you know, this and slightly reduce the amount of acidic foods or spicy fried items. Sweeteners like chocolate, sweets, ice creams, tea, alcohol, all of them precipitate or aggravate the sensation of urinary tract infections. So by doing this more conservative approach, even without antibiotics in asymptomatic UTI, we can control the amount of pus cells. For example, we have treated the UTI, but the patient has stones. If it is stones, then depending on the location of the stone, the size of the stone, and the symptoms associated with, different methods of treatment for stones can be seen. And if the patient is diabetic, sometimes diabetics also are more prone for recurrent UTIs. In that situations, the sugar levels need to be noted and controlled. Okay. So talking about the stone disease, as I've said, so stones, one of the most common cause of stone formation, be it in men or women, is infection. Repeated attacks of urinary tract infections allows these calcium and other minerals to deposit in the kidney or ureter or bladder and result in stone formation. The other thing, as I've said, is dehydration. When you don't drink ample amount of water, then your urine becomes concentrated. These minerals tend to get deposited and they result in stone formation. Your diet, in certain people, who are genetically prone to formation of stones. In them, if they are having oxalate food, rich food. Now, what is oxalate rich food? Tomato, palak, beetroot, chocolates, spinach. All these are high, what you call oxalate containing foods. Having these kind of foods also can result in stone formation in them. Gout is a situation which is seen because of increased uric acid levels in the body. They have severe joint pains and other situations. Even in that, special uric acid stones are formed. The other thing is hyperparathyroidism. Parathyroid is a special gland that is present on the backside of the neck, and increased the amount of that hormone produced can result in increased calcium levels in the urine and result in stone formation. So this is just a gist. So there are different type of stones, but the four most common type of stones that we see, the most common are the calcium stones, be it calcium oxalate stones or calcium phosphate stones. The other stones are uric acid stones, which are generally formed in those who have high uric acid levels in the body, like gout. Struveite stones, you might have heard large stones in the kidney there. They're generally made up of magnesium, ammonium phosphate. They're very large stones. And these stones can also are generally formed in the presence of infection. They're infective stones. The other type, not so common stones, are cystine stones. So as I said, what are the general symptoms seen with kidney stones? They complain of that severe low backache. The pain can radiate forwards. They can complain of episodes of vomiting, dizziness. There can be severe pain in the back, blood passing in the urine. Then fever, low-grade fever, chills, severe pain while passing urine, and these are the general symptoms. So how do you diagnose stone? Stones cannot be diagnosed on a complete urine examination. Complete urine examination will only tell you about any presence of infections. And if there's infection, we need to treat the infection before treating the stone. X-ray KUB, yes, can tell to a certain aspect. X-ray KUB can tell stone size above 1 centimeter, be it in the kidney or the pipe, the ureter or the bladder. Ultrasound is a better test, which will tell you about the location of stones, any infection around the kidney or other part of urinary tract, and any swelling associated with the stone. But the most specific and the sensitive test to diagnose any size of stone at any location of the urinary tract is a CT. A CT abdomen and pelvis is the most definitive test that can tell you about the location of the stone, the size of the stone, any other swelling associated with it, or infections associated with the stone. So based on the CT, we can take a decision as to what needs to be done for stones. So for all the participants who are logged in, don't get petrified or worried when you see stone in your ultrasound. Not all stones require surgery. Only stones which are more than 1 centimeter, which are symptomatic, which are hampering the functioning of your kidney, only require surgery. Stones less than, I wouldn't say 7 mm, but less than 5 or 6 mm with adequate amount of fluids and with certain alkalizers, they can easily pass off in the urine. Yes, stones above 7 mm sometimes do get stuck in the ureter. Those might require surgery, but do not get worried seeing kidney stones of 6 mm, 7 mm in your ultrasound. When you do not have any symptoms, you're just having mild low backache, you just got a general checkup done and there were stones, please do not get worried. Because as I said, all stones do not require surgical management. Only stones which are causing hampering of your kidney functioning. If the stone is very large in size, means anything more than 1 centimeter. If you are severely symptomatic, only require treatment by surgical management. Okay.
I think this is a good news for many of the people.
Yeah. So how do you generally prevent or manage small stones? One best thing, it's a mantra from all urologists. Please drink water. Water. If you have adequate amount of water, 60% of your problem is solved. The other thing is, a lot of people think that the minute they get stones, they stop eating calcium. Their diet is completely nil of calcium. Never ever do that mistake, please. If you completely stop having calcium in your diet, a substance called oxalate starts getting absorbed from your intestine. It starts getting deposited in your kidney. If you don't form calcium stone, you'll form some other stone.
Oh.
So calcium should be reduced in your quantity, but you should not completely stop having calcium from your diet. It will lead to other problems. Okay. So avoid intake oxalate containing food. This is not for everyone. This is only for people who form stones recurrently. For them, we ask them to reduce the amount of oxalate containing food like tomato or spinach or strawberries or rhubarb, teas, peanuts, chocolates, dark chocolate and all that. Okay. Exercise, yes. Exercise is very important, not just for your kidneys, but your physical and mental health. It keeps you fit, and because of that, it's not just about kidney problems, but you will be away from many other problems related to your body. Okay. The other thing is, as I said, we identify and treat the cause and surgically remove the stones.
Okay.
The next thing, before I come to the home remedy, a lot of people have doubts. What are the different surgical treatments you have for stone? Urology has advanced so much that unlike other branches, we do not have to open the abdomen to remove a stone. We have advanced very much, where we have specialized scopes which pass through the urinary tract. We have specialized scopes to even reach every nook and corner of the kidney, identify a stone and blast it using laser.
Oh.
So very, very rare occasions, in very extremely rare occasions, do we have to open up the kidney to remove a stone. Otherwise, opening up a kidney is almost an obsolete procedure in urology. Most of them are manageable endoscopically. So just a couple of home remedies before we end up with it. As I said, have a lot of coconut water. Non-diabetics can have coconut water, barley water, have ample amount of buttermilk. You can have meat and poultry, but I would suggest if you can reduce the amount of red meat that you're having in your food, because it has a lot of urea and uric acid and the proteins which will lead to stone formation, it would be great. Always, all fruits are very good. Be it apples or melons or grapes or vitamin C containing citrus fruits, they all are very healthy and they prevent stone formation. And as I said, do not completely stop having calcium, but just reduce the amount of calcium in your food. That is more than sufficient. If you completely stop having calcium, there are other problems that you will land up in. So the final take-home message that I would like to give is, be aware about urinary tract infections and kidney stones. Do not take them easily. At the same time, don't get unnecessarily tensed and worried. If you have any symptoms like this, please do visit your urologist. Thank you.
Excellent, ma'am. Ma'am, I think in the entire presentation, the good news for everyone is more than unless it is more than 1 centimeter size and it is symptomatic, no need for any is actually required.
Yes.
That's a great thing, ma'am. And I request attendees to raise their hand if they want to ask any questions. We'll be taking one by one. Even you can also put up your question in the chat box. I think Mr. Ajit wants to ask. Sir, I'm just allowing you to ask. You can unmute yourself and you can ask. Sir, I think you're on mute.
Hello.
Hello. Yes.
Are you able to hear me?
Yes, Mr. Ajit.
Yeah. I have a small doubt. Okay, as you said, this urine passing and all those things not to hold a long time. If people don't have sensation for to pass the urine frequently, means a long time, they won't feel to go for. So is it something alarming situations, or it is I don't know?
No, in a normal situation, if you're having about 2.5 to 3 liters of water per day, sir, your normal intake, I mean, going to washroom will be around 8 to 10 times a day, which is normal. Even if you're going about 6 to 8 times a day, it is still normal. It depends again on your bladder capacity too. But the one thing that we would suggest is do not hold urine for a long time. Is we would say don't hold urine for 8 hours, 10 hours. A lot of people do that, but that is the only thing. If you can go to washroom every 3 hours or 4 hours also, that would be good.
Okay. Okay.
Okay.
Thank
you.
Yeah. Thank you. Thank you, Mr. Ajit. Arun wants to ask. Mr. Arun, you can talk.
Yeah, hi, doctor, this is Arun.
Yes.
I have my mother, she's 83 years old, and she has this condition called incontinence, doctor.
Okay.
So she uses Depends.
Okay.
So my question is, while she's still aging, continuous usage of catheter, I mean, she does not use anything like that, but then going forward, in case it is a requirement or it is for convenience, is it okay to use catheter for a long time?
Yeah, so Arun, it's a good question. Incontinence is quite a problem, especially in women. So, and if it's a continuous incontinence and, if you are not able to use adult diapers or anything, and if you want to catheterize it, be cautious that the catheter needs to be put under complete sterile conditions and without any infection any around. It is very important that it's placed like that, and it needs to be changed every 15 days. If it is not changed every 15 days, or it is kept, or when the Foley's catheterization is done with any infection anywhere around, then the chances of catheter-associated urinary tract infections are very high. So if you are planning to catheterize your mother, then please be aware of these two situations, because catheter-associated UTIs are very, very common.
Okay. Okay. Mr. Ganesh is also here. He wants to talk. I'm actually allowing Mr. Ganesh to talk. Over to you, Mr. Ganesh.
Hey, hi. My name is Ganesh. Thank you for scheduling this call. Okay. Actually, I wanted to ask some questions regarding this. So my father was admitted due to UTI infection in the last month. Okay. So till that time, we were not aware about this disease. And suddenly one day he said his urine is passing very hot. And we suddenly admitted him. So doctor said it is due to urinary infection. And he treated him with the medicines and all this stuff, and he got discharged after 2-3 days. He was okay. Already he had means my father passed away in this month, so unfortunately. So not much age, only 63 years of age he was. And suddenly after 2-3 days he got discharged. He had blood pressure, means BP and sugar. And suddenly after 1 or 2 weeks, he had some weakness. So doctor was saying because of urinary infection, his sugar level is dropping. Okay. And we got admitted him into the hospital. And after that, it led to, I think, doctor said that his kidney is also swollen. If he would have done that stent operation earlier, we could have delayed this situation. But because of his health condition, we delayed that for 1 month. And we admitted him. After that, he had a lot of weakness. And it led to, I think, because of BP and sugar, it led to brain hemorrhage. We did operation, but unfortunately, he couldn't survive after more than 7 or 10 days. So how should we detect this disease? We had no clue about this disease till that urine, he was passing the hot urine. So how can we, other diseases, we can find out that there are some symptoms, but what about the urinary
early detection? How can we do it?
Yeah.
Yeah, so urinary, that's what, as I said, urinary tract infections are not very common in what you call males, Ganesh. So if they start after the age of 50, I would suggest for all males after the age of 50, please get an ultrasound abdomen and pelvis done. Why? One, to detect your prostate enlargement. The most common cause of UTIs in men after the age of 50 is BPH, benign prostatic hyperplasia, prostate enlargement. So what it does is prostate enlargement tends to hold your urine back. It does not allow the entire urine to pass. So that urine that has stagnated multiple times can result in infection. So when this is not detected at an earlier phase, this infection tends to spread upwards to the kidney and cause something called as pyelonephritis. So once that pyelonephritis stage happens, it has to be degested on both sides or one side. and the other comorbidities at that point of time have to be treated. So after 50 years, the best thing that I would say is please get an ultrasound abdomen and pelvis done, because that will tell you about any stagnant urine left over and about your prostate volume. Once you get a hold of it, it is more easier to treat your urinary tract infection because your root cause called your prostate is being treated.
Okay. Ma'am,
Thank you.
we have, yeah, thank you. Thank you, ma'am. Ma'am, we have also seen, like, now when people are actually traveling, especially when we are going with the family, many of the times it happens like the ladies in the family, they tend to hold the urine for a longer time.
Yes.
Unless we get a proper washroom on
True.
the travel. So what is actually, like, no, what is the thing that after that kind of situation, what are the things that the women need to do to take care, like, no, it doesn't lead to the infection?
So that's what I'm saying. This is very commonly seen with women only. So what they do is they've learned, or they've habituated to the point of holding urine for a long time until they're psychologically feeling that this place has a good washroom. So I would suggest that if you think you're traveling for a longer time and you have to hold urine, then also please don't hold urine. You can use something like a pee safe or anything like that on the washroom that you're using over there. That is going to sanitize the area that you're going to pass urine. And please do pass urine. Wash your genitals over there and keep it dry. That is more than sufficient.
Okay. Ma'am, I'll take one question from the question and answer chat. What we have here, Mr. Harish has actually put up a question. What's the recommended water intake for a kid under 6 years per day?
Yeah, for a 6-year-old.
We don't drink. We have to push.
Yeah, I know, it's quite difficult. If they can have anywhere between 500 to 750 ml of water in a normal time, and in summers, if they can have up to 1 liter, that is more than sufficient.
Okay, great. There's also one more question here. I think, I don't know whether it's a myth or whether it's the fact. Mr. Shishikumara, M. Shishikumara has actually put up a question over here. Many people will say, like, no, drinking beer can actually prevent the kidney stone. Is it true?
Yeah. So beer is not going to prevent your kidney stone. It is like a diuretic, but you will be saving your kidneys, but you're going to take your liver for a hit.
Oh.
So
even more damage?
In your search of trying to save the kidney, you are going to destroy your liver. At least one kidney is destroyed, you have another kidney for backup. But if your liver is destroyed, you do not have anything else for backup.
Oh. So Shishikumar, I think probably it need to be compensated with the coconut water and also just only the beer. Okay, ma'am, there's one more question here. Is it a good sign that the urine is always transparent? And what does it mean if it is not transparent? And does it mean an alarming? And what are the basic things to check for any infection?
Okay, so the normal color of urine is pale yellow. If you're having transparent urine, that means your water intake is very good. Keep it up, nothing to worry. Only if the color is dark yellow, brown in color, or any other color, yes, then it is alarming. But otherwise, pale yellow or white is a healthy sign.
Okay. Ma'am, there is also one more thing. Whether urine infection is seen in male also, that's Mr. Naveen. I think, doctor, probably you can repeat the same thing once again.
Yeah. So urinary tract infections, yes, they do occur in men too, but they're much less common when compared to women. Same thing, if you're dehydrated, you don't drink water properly, your food lifestyle habits are different, if you're stressed out, then in young men, it is common. In men after 50 years, it is generally because of prostate enlargement.
Okay. Ma'am, there are a few more things, a few questions I have. Like I was just doing a little survey on this. There's also something like alkaline water. These days, there are many people who are actually even promoting alkaline.
Yeah. They have come to me also.
Okay. Will that actually have it?
See, alkaline water is going to make the kidney or the entire environment alkaline. Yes, it is going to prevent a majority of the stones. But there are certain other type of stones which grow exclusively in alkaline medium. They are called as true white stones. So whatever water we are having, be it RO water or UV water, is more than sufficient. I wouldn't recommend much of an alkaline water, because up to a point, alkaline water is good, but after a point, then it will become harmful for the kidneys.
Okay, ma'am. It actually reminds me of one thing. Swami Vivekananda says anything which is excess is always dangerous.
Yes.
It's poisonous. That's what.
Yeah. True.
So probably a blend of everything together.
Yeah.
Thing. Okay. And ma'am, one more thing. Children, they also tend to stop the urine once they go to the school, because
they do.
Allowing them to go, or in the interval they're actually writing some homework or something. So they keep tending to do that. And will that have how to handle this?
So generally, even though children tend to hold urine for a long time, even in schools and all, they will not face urinary tract infection at that age, because that age body has multiple other mechanisms to recoup it. But they will start having problems when they are around 12, 13 years old. They will start having recurrent UTIs at the age of 12 years, 13 years. It will keep on happening until the age of 25. Sometimes these recurrent urinary tract infections can damage the kidneys and all. I would urge or request all parents to counsel or tell their children not to hold urine for a lot of time, to take interval time, or they have class in between classes interval to go pass urine, or at least if they can pass urine twice in a regular school time, that would be sufficient.
Ma'am, is it? I don't know how true it is. I have actually heard from one of my friend, because he was completely under the pressure to pass the urine. He just went out and then he passed the urine. But it seems there is already some other people have urinated in that particular place. And after he has actually done the urination there, immediately he felt there is some pain in the lower abdomen.
Yeah, so immediately you will not get infection. It doesn't happen like that. Imagine there is an infected washroom and you have no other go, but you've gone and passed wash. If you pass the toilet, one thing I would suggest is immediately wash yourself with water.
Oh, okay.
And wipe yourself off. Then you will not face any other problems.
Okay. Ma'am, during your presentation, you said about the cross-contamination.
Yes.
Can you just brief?
Yeah, so what is cross-contamination is, there are good bacteria and bad bacteria in all of us. In all of us, we have something called good bacteria that is required for the body, and there is bacteria. So this E. coli is a bacteria, the most common one which causes UTI, is present in our intestines. Okay. So when we pass stools, sometimes, especially in women, if you don't clean properly, or if you're using in unhygienic environments and all, this E. coli tends to spread very fast into the urinary tract, because the urinary tract and the intestinal tract are very close by. The distance between the urinary tract, the opening of the uterus, that is vagina, and the anus is only about 1 to 1.5 centimeters distance. They're all very close by. So that is why cross-contaminations are very common. Okay.
Got it, ma'am. Let me take one question from the question and answers here. There is, I think SRPT is what the name. A woman has a problem that she does, but she doesn't feel the sensation to pass the urine, but suddenly she passes out. Okay, what could be the problem and how to resolve this? Let me just restate it. Probably it means she doesn't feel like going for a urination.
Okay.
But she gets the urinations so heavily. So what could be the reason? And
so this we need to evaluate actually. So if she's not having sensation of urine and the urine is leaking out, we need to ask her very specifically her symptoms. Does she have continuous leakage of urine, or is the urine leaking on coughing and straining, or does she get sudden sense of urgency and by the time she goes to the washroom she passes urine? So there are different entities like overactive bladder and incontinence. We need to actually evaluate the patient and then treat it accordingly.
Okay. Probably we'll share the details of the doctor. You can also have a consultation with the doctor on that. Okay. And ma'am, one more thing. Children normally they tend to pass urine in the bed, like while they're sleeping.
Yes.
Sometimes in few children we have seen it continues till age 13 and 15.
Yes.
Okay. So is that any in line with any of the infections which they have?
No. So that is, in our terminology, is called as nocturnal enuresis. In layman's terminology, it's called as bedwetting. So generally, children pass urine in the bed up to age of 4 years. Some do not, they still don't get the control of urine. So it happens up to the age of 6 years. But if it happens after the age of 6 years, if it continues up to 12 years, 30 years, maybe 20, 25 years, then it is called as nocturnal enuresis. So for that, the first thing is we need to identify what is the reason of nocturnal enuresis. Is it because the child is an extremely deep sleeper, or is it because the bladder capacity of hers is small, he or she, or is it because their bladder is either overactive? It will be either of the three most common causes. We identify the cause, and I would, if there are any parents watching this, I would tell them, please don't get worried about bedwetting. Bedwetting or nocturnal enuresis is a very, very easily medically treatable condition. Only thing is it requires a treatment of maybe 3 to 4 months, but it's always a treatable condition. It's not a lifelong condition, and it's a curable situation.
Okay. And ma'am, like the children, they tend to become young, and there's a lot of hormonal changes which also happen. Okay, and
Yes.
especially with the students like now who came into the teenage.
Yeah, the puberty.
Yeah. So will they also have the similar kind of
Yes, in puberty, infections are more common in women because there's a whole different cycle or a dimension that happens in women from becoming a girl to a woman.
correct?
Yes, in that time, the chances of urinary tract infections are high, but if you can drink adequate amount of water and pass urine regularly and keep exercising and keep healthy, I think the chances are very less.
Oh, okay. And then I'll pick up one more question from the chat here. Is there any scientific proof of consuming water from RO or UV filters, which will filter out almost much of minerals from the tap water? Drinking water after boiling is still good. Kindly help us out in knowing a little more thing. This is a question from Mr. Chandrasekhar.
Honestly, I have no idea regarding the census or the workup that has been done on this RO or UV.
Right. But, okay.
It does not completely see our water. If you have to compare the water that we are drinking now to compare the water that people were drinking 50 years back, definitely the water we are drinking is quite more polluted. Even if it is properly treated by our government, it is treated by RO, UV and all, it is still contaminated. The best way you can avoid it is boil the water, let it cool and drink. But most of us do not have time to do it. So I think your RO or UV should be more than sufficient. You want to have the most ideal way of drinking water, boil the water, cool it and drink it. That would be the best way.
I think Mr. Chandrasekhar, you got the answer now. Okay, I'll take one more question. It's from Mr. Srinivas Achenta. I said, he's saying my father-in-law is 80 years and complains that in the night very frequently he goes for urine.
Yes.
Since sleep with an extremely urethane condom type. Yeah. I think the person complains about the frequent urine in the night.
So this is very common in men who have increased prostate in size. So if the prostate size is increased, these symptoms are not commonly seen in the daytime, but they're especially seen in the nighttime. They get up multiple times in the night to pass urine. This is increased frequency, and because of that, their entire sleep pattern gets disturbed. So I would suggest your father to undergo an ultrasound abdomen and pelvis, check his prostate volume or the prostate size and get it treated accordingly.
Mr. Srinivas wants to talk. I'm just allowing him to talk.
Yeah.
Mr. Srinivas, you can talk to the doctor directly.
Yeah. He's regarding just now discussed the condition, no?
Yes.
Yeah. We have done the ultrasound test, abdomen test and everything. Everything is fine, and she is using the 8 mg tablet. I don't know the tablet name exactly.
Called Celadosine.
Celadosine 8 mg. Still, he says the problem is coming. And maybe night time, he says, because he's in the sleep only, he's passing the urine. I ask him to stand up and do the things. He says not possible for him.
Yeah.
Doctor says cytoscope or something. One doctor suggested to go for that cytoscope test
Okay.
to know how is the prostate is there.
Yes.
Other doctor says that is not required. We'll see with the medication only.
Hmm.
Okay.
So generally, Srinivas, only Silodosin
Yeah.
if they have given, only Silodosin is not going to solve the problem. It should be a combination of Silodosin with dutasteride or Silodosin with something else. So for that, actually, I need to talk to your dad, see all the reports, and only based on that can be, the cystoscope is generally not required. It is only in other special situations we require cystoscope. Ultrasound will give a rough view. Sometimes even in ultrasound, we don't get a complete view. We need to ask symptomatology exactly, evaluate it, and then put him on medication.
Okay.
Ma'am, for your information, Mr. Srinivas actually stays very close by to your hospital.
Oh, okay.
Yeah.
In the lower tank band. Sir, probably you can have an appointment with doctor and you can go and talk to her directly.
That's what I am feeling. Maybe RTC Crossroads is quite nearby.
It's quite near. Yeah, I know your place.
Yes. Thank you. So that's that will be a better, I think.
Correct. Probably you can also take your father-in-law along with you.
Yeah, I do that.
Okay, thank you.
What is the normal timings in the hospital?
I'm there from 9 to 4.
9 to 4. That's great.
Yeah.
Okay. Thank you.
Thank you.
Right.
Ma'am, there is one more question from an attendee here. He says, by taking mushroom frequently in our regular food, will it affect the kidney?
No, it doesn't. It does not.
Okay. And there's also one person, Mr. Narayan Rathod. What's the way to prevent gallbladder stones? Like, is it?
Gallbladder stones are very different from your kidney stones. They are more of cholesterol stones. So, as I said, not all gallbladder stones also require removal of your gallbladder. So, based on the size of the stone, the symptoms that you have, the location, some can be treated medically, some can be some require surgery. So it depends on the size of the stone, the number of stones, the location, and the symptoms.
Okay. And what are the ways to prevent gallbladder stone? Is the continuation statement probably? Ma'am, can you still answer that?
Yeah. Have low fat diet, exercise, lose weight. They are the most important things to resolve gallstones.
Okay, great, ma'am. Ma'am, I have a question. Like, in summer, my mom used to give a lot of barley water. Okay, and she says like, no, nothing can beat actually the barley water. and sometimes, like, no, when we say no, she used to push it by putting some sugar or something and then give it. Okay, so will that have a really great impact on the body? Like
barley water is a diuretic. It will help you flush out any toxins or anything present in the kidney or your system into the urine. It is not going to treat an already present condition, but yes, it does prevent the occurrence of UTIs or stones. Yes, it does.
Okay, that means probably if somebody is having a lot of infection in the body, best thing which can flush it out.
That's what I'm saying. If you already have a urinary tract infection, then barley water is not going to really treat the urinary tract infection. But if you are having barley water on a daily basis, you can have it. It is going to prevent you from formation of urinary tract infections.
Okay, and ma'am, in winter or in the rainy season, if we drink barley water, it seems we are going to catch some cold. Is that true?
No, not no.
Okay, great, ma'am. Let me just take one more question here. Mr. Rahman is actually putting up this question. Does eating non-veg more frequently cause an issue?
Yes, it does. Yes, it does. Because non-veg it's not just about chicken that you eat. You eat mutton. You have somebody has pork, somebody has beef, somebody has fish, somebody has crab or prawn. So these tend to have a lot of high protein, urea and uric acid. So in higher contents, they do cause a lot of burden on the kidneys, not just on the kidneys, but the liver, the gallstones, and also the kidneys. Yes, they do have a detrimental effect on the body.
Okay. I have this one more question coming up here. Mr. Adarsh, madam, drinking excess water is also going to affect the kidneys?
Not really, no. Only that is in persons who are suffering with certain kidney problems. Yes, we ask them to have restricted fluid, but otherwise, having good amount of water is never going to harm them.
Okay, okay. Ma'am, Mr. Srinivas wants to ask one more question. He's requesting for calling up. I'm just putting him on call, ma'am.
Yeah.
Mr. Srinivas, you can talk to the doctor. You can unmute yourself and talk. Srinivas garu మీరు mute లో ఉన్నారు. Yeah. I think he's unable to unmute himself.
Yeah, just okay.
Yes,
I'm
sir.
done.
Yeah.
Recently I found with gallbladder stone 22 mm in the neck.
Okay.
So, do I require to undergo surgery or
so that depends on your symptoms, and it is better that this is being judged by a general surgeon or a surgical gastroenterologist. They will look into your films and your symptoms and take a call whether you require lab cholecystectomy or not.
No, there is no symptoms. Actually, I had intestinal infection recently. That time when I did my ultrasound scanning for abdomen, they said there is a gallbladder stone in the neck.
So only if it is symptomatic, you can visit. Otherwise, nothing to worry about.
Okay. Great. Ma'am, there is one more question which has come up. Mr. Naveen, he's also a person like who actually manufactures the organic fluids for drinking. Okay, Mr. Naveen, he actually asked, does apple cider and vinegar inhibits gallbladder stones and even the stone formation in the kidneys?
Gallbladder, I'm not sure, but yes, it does prevent. Yes, it does prevent. It prevents urinary tract infections and it prevents formation of stones. Yes, it does.
Okay, done, ma'am. There is Mr. Adarsh. Madam, is smoking is going to affect on the kidney stones and also even
not just the kidney, from your brain to toe, it's going to affect every organ of your body.
Okay, great, ma'am. This I've seen even the people who go for the gym and wants to make a healthy body, not just a healthy body, but also want to have a good shape of the body and things like that. They tend to go and have more amount of protein-rich liquids and protein-rich. If more protein is taken, will that actually have any impact on this?
Yes, it does have a lot of impact on the kidneys. Okay. Proteins are, as they say, yes, proteins are the building blocks of the body. But there is certain amount or a threshold of protein that we need to take. Our regular food, or the ones which you have dals or pulses or millets, or all of them have adequate amount of proteins, or the beans or the soya chunks, or all of them have adequate amount of proteins, or the non-veg that we are having. Apart from that, if you are trying to take protein shakes or protein powders, it is going to have an effect on the kidney, because kidney up to a point will able to prevent the loss of proteins in the urine. But if it exceeds that point, and if the proteins start going in the kidney, in the urine, then it means that the functionality of the kidney is getting damaged. So protein shakes and
more protein than what is required.
Yeah, you can have your regular dals or millets or pulses, your non-vegetarian, your beans, your soya chunks, all of them have adequate amount of protein. That protein is more than sufficient. Your sprouts and all, you do not have to require your protein powders or protein shakes to do it.
Okay, ma'am, sometimes even people go for the urination. There's a frothing which actually happens.
Yeah, it depends. I mean, normal frothiness is okay, but if it is excess of frothiness in the urine, yes, you need to get a complete urine examination to check if you are losing proteins in the urine.
Okay.
Yeah.
Okay, great. And ma'am, coming to this complicated symptomatic things you were saying in your presentation, like
Yes.
conditions and things like that, like people with the diabetes, especially, because
Yes.
they tend to have more amount of sugar-related thing in the body, which is actually flowing through. So, what kind of measures which they need to take?
First thing is, if they're diabetic, the first important thing is check your sugar levels and check your HbA1c. Are they under
HbA1c.
control?
Mhm,
If they are
mhm.
under control, very good, you can manage with your diet. If they are not under control, please visit your endocrinologist or your general physician and see
Mhm.
to it that the medications or insulin or whatever needs to be taken.
Okay, okay, great. And yeah, Mr. Adesh wants to ask a question. How to know whether a person kidney is in a good condition?
Yeah, so you have something called as a renal function test. It's a basic blood test,
Oh,
which will tell you about the serum creatinine values, the blood urea, the uric acid levels. So a basic renal function test is more than sufficient to know if your kidney is in a proper functioning state or not.
okay, okay. I mean, a normal, what do you call the annual health checkup kind of things, like people who are more tending towards like being healthy, they also tend to go for the annual health checkup.
Yes.
These annual health checkups, does all these renal function tests
Yes, yes, they are covered in your annual health checkups. Yes,
in a
yes.
normal?
Yes,
Okay.
yes, yes.
Great, great, fantastic, ma'am. And so coming to this test, what you said, I'm just trying to wrap up and then go through the main things that we have actually discussed, so that people who have joined in between also can actually understand it. Like, okay, so alkaline water is something. If the body is more alkaline in nature, then probably the infection levels can actually come down. Okay, and for that we need to always maintain less amount of acidity nature. And then we have also seen like there is a complicated and uncomplicated situations, and complicated is more of homobride kind of conditions in place. And it is also seen like people who tend to hold the urine more often without passing. Okay, they might tend to get more amount of urinary tract infections. And in female, it is actually seen more because of the condition what is there with them, because of the less distance between and the cross contamination which can happen. And ma'am, one more thing, like people who are more stressed, like if somebody I've seen like they tend to work so hard, like and especially the people who are on the higher level, okay, or the senior level managers kind of thing, they just get into their cabin, they put on their AC, they don't even tend to go to the bathroom because there's a lot of pressure of work which is actually coming up. What do you actually suggest for them?
I would say first take care of your body and then take care of your work. Because if you can take care of your body only, you can take care of your work. Otherwise, you can never take care of it.
Now, if you say these things, probably like you will never see, will have very less number of patients coming on to you.
Yeah, but yeah, I mean, all of us are ambitious, all of us have careers, we all have goals, but then our health comes first. Everything comes later.
Yeah, and obesity, others, obesity is also going to affect. That's what the doctor said in the presentation. So your physical
Yeah.
your mental fitness is actually going to have an overall healthy condition of the person.
Yes.
Right. And the best thing, the things which have been suggested by doctor is minimum we need to have 3 liters of water per day. 3 liters of water per day, and not no calcium, but low calcium diet. Ma'am, just correct me if I'm wrong anywhere. Okay, I just made a note. Okay, and then if there is a recurring kind of infections which are happening, then it is little worried condition, because it might even tend to go for the stone formation.
Yes.
You have to go to the doctor. Right, and the best,
even if it is a first episode of urinary tract infection, you still have to go to the doctor. Do not take over-the-counter drugs.
Oh yes,
yeah,
and we are more tend to take the over-counter drugs.
Yeah.
Yeah, and the best part which I actually found, which I actually got to learn is unless the stone is more than 1 centimeter, and unless the situation is symptomatic, no need for any kind of
Yeah.
or any kind of treatment to be started. Right, ma'am, with these things in way and people with who have just crossed, especially the male who have actually crossed 50, it is required to go for the CT.
Ultrasound.
Oh, sorry, which test is that, ma'am?
Ultrasound.
So yeah, ultrasound need to be we need to undergo that as a preventive diagnostic.
Yes.
Okay, and I think this is what we have actually learned, and ma'am, we are actually done with our session now, and we thank a lot, not only from the Mallapuram team, but all the community of Mallapuram, like all the people who are there who have actually attended this particular webinar. They are all our clients.
Okay.
Every one of them are with name. Okay, we can identify them. I know I'm only seeing their names over here, but I know them in person. Okay, so this is the community, and I thank guys. You have actually taken up this registration and then coming in and then putting up your time and effort. We'll send across a small poll. Okay, just to see like now how did you get this total webinar done. Okay, so we have just launched feedback on this. You can still give a feedback. Okay, but ma'am, meanwhile the feedback is going on, we actually thank you right from the heart of our community here. Okay, for actually taking out your time. I know how busy you are. We actually wanted to do a practice session yesterday, but doctor was on a very complicated case, and she was actually doing the surgeries. And even now outside her cabin, I think around 20-25 people are still waiting to see her. Okay, ma'am, in these busy hours, you have actually taken out the time and being over here. And I also thank your management from Srikara, Mr. Imran and the management, okay, for helping us out in conducting this value-added information for all our clients. Thanks.
Yeah.
Thanks a lot.
Thank you so much. Thank you so much.
Thank you. Thank you. Thanks a lot, ma'am. And thank you a lot for all the people who have attended and also given the feedback. Thanks a lot.
Thank you.
Thank you. Ma'am, with your permission, now can I end this?
Yes, please.
Thank you. Thanks a lot. And guys, we'll be sharing the details of the doctor also. You can contact her directly.